Hello, I am Bionna Belcher, and I am a Master of Athletic Training student. The topic I chose for my critically appraised topic is hip range of motion on upper extremity pitching kinematics. I chose this topic because there's a lot of literature and research out there looking at injury risk factors for pitching athletes, and a lot of that research was done on upper extremity range of motion and how that affects upper extremity kinematics. But I wanted to see if there was research out there that looked at the relationship between lower extremity range of motion and upper extremity pitching kinematics and how that affects injury risk. So my main objective for the study was to review the literature to understand the full relationship between hip range of motion and upper extremity kinematics during the pitching motion. And so for my methods, I used several different sources. I used Medline, PubMed, ScienceDirect, and Google Scholar. For my search terms, I used several different search terms looking at hip range of motion, hip rotation, and upper extremity kinematics, which also included shoulder and elbow kinematics. For my inclusion criteria, I only included articles that looked at male pitching athletes, articles that studied hip range of motion and upper extremity kinematics, articles published within the past 10 years, and if they were available in English, and articles that had a level of evidence of 3 or higher. For my exclusion criteria, I did not include studies that looked at non-athletes or non-pitching athletes, articles published over 10 years ago, and articles that were not available in English. I found a total of 6 studies that met my inclusion and exclusion criteria, but I only included 3 of these studies because of the limitations of the other studies. One of these studies looked at hip range of motion and upper extremity kinematics. However, it was only a segmental analysis and didn't actually look at that direct relationship. And other studies looked at hip range of motion and upper extremity range of motion in pitching athletes, but they didn't actually look at the active pitching motion. And the other 3 studies that I included did look at that active pitching motion. So 2 of the 3 studies I included looked at Division I college baseball pitching athletes, and the other one looked at high school baseball athletes. And all 3 of these studies did find a significant relationship between hip range of motion and upper extremity kinematics, but only 2 actually supported my focus clinical question, which was, do deficits in hip range of motion lead to compensations in the upper extremity, which leads to increased injury risk? And so 2 of these studies found a negative relationship between hip rotation and shoulder external rotation. And so as hip rotation decreased, shoulder external rotation increased, and they found this relationship in the lead and the trail legs. And so they concluded that due to this shoulder compensation, that could lead to increased upper extremity injury risk. Another study also found that lead hip internal rotation had a positive relationship with elbow flexion angle. And so as hip rotation increased, so did the elbow flexion angle. And so the thought process behind this is that as elbow flexion angle increases, that shortens the lever arm, which leads to decreased injury risk. And vice versa, as hip internal rotation decreases, elbow flexion angle also decreases, which lengthens the lever arm, which increases injury risk. The study that did not support my clinical question did find that there was a positive correlation between elbow varus torque and lead hip abduction. And so as lead hip abduction increased, so did elbow varus torque. And they looked at this as more of a performance enhancing component. They saw as this hip range of motion increased, it caused the kinetic chain to work more efficiently, which led to more torque. However, they did acknowledge that this could also lead to injury risk if this compensation is too much. So based on this evidence, it is able to be concluded that hip range of motion has a significant effect on upper extremity pitching kinematics. However, more research needs to be done to see if there is actual correlation between hip range of motion and upper extremity injury rate.